Hello, I'm Dr. Robert Lelouch, a board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk about GLP-1 medications. And that would be Mounjaro or Zepbound or Wegovy or Ozempic. And this again is to give you my experience as a clinician practicing for years, but not a scientific analysis of these medications or all of the risks and benefits. I encourage you, if you are interested in weight loss and including these medications in your armamentarium, to have a discussion with your physician for those details. But the reason I'm bringing this up is that I'm very enthusiastic about the medicines. I think they are one of the most significant groups of medicines that I've ever encountered in my practice. I think their impact is excellent, and they're going to have a huge impact for years to come on a large percentage of our population who has issues with being overweight and obesity. So again, I'm bringing you my experience. I want you to discuss with your physician, but if you are struggling with weight, or if you have for a while and other methods haven't worked, I've found quite a bit of success in my patients. I personally do not prescribe these medications at this point. I think that's the realm for an internist or a family physician, but I do help discuss with my patients obesity, weight loss strategies, dealing with diabetes, and encourage them to look into these medicines. Their cost is coming down, their success rate is super high. GLP is glucagon-like peptide, and really what these are medicines are, they simulate a protein that comes from your intestine, from your gut, your stomach, and goes to the brain, and it tells your brain that it goes to the satiety center, the centers of your brain that tell you you're full. So when you eat an amount of food, after a while you get a signal from your stomach that says, okay, you've had enough. And these medicines mimic that and tell you you've had enough and decrease those unending cravings for food. They help slow down the digestive process, leaving your stomach full longer. Sure, you can have some side effects, some gas pains, some discomfort. Some patients, it's too intolerable, but to many, it is quite a bit more tolerable than hunger pains and being overweight. So if you've been watching my videos for long enough, you might notice that I have lost some weight. I have been somebody who's worked on their weight, diet and exercise for years and years, and it does get a little harder with age. And I have used a GLP myself and have had great success of losing 35 pounds in under 6 months. So I also support it directly. Which of the medicines? Well, Wegovy, Ozempic are the same ingredients with labels either for diabetes or weight loss, and Zepbound and Mounjaro are the same ingredients, and they are one for weight loss, one for diabetes. What I have found, again, my experience, is that for some patients one works better than the other. Some have a lot more nausea with one than the other. For me, I have tried both, and one worked better than the other. For my wife, it was the opposite. So I encourage you, if you've tried one and it doesn't work for you, well, that you consider trying the other. The climate is changing, the prices are coming down, there are oral medicines coming out, so you do have to give yourself an injection, but there are oral medicines that may be, will be eventually a lot less expensive and perhaps simpler to take. I do believe that a vast majority of those of us who are overweight or have struggled with our weight will be on these medicines as chronic medicines, meaning just like over time to combat high cholesterol, we continually take cholesterol medicines, or high blood pressure, we continue to take hypertensive medicines and don't bat an eye because they've been demonstrated to have benefits. So too, I believe, will be the case for the GLP-1 medicines, and that there will be a maintenance of being on those medicines for a while, and that will have tremendous benefits of keeping your weight down, at reducing other the benefits are expanding, like reducing other addictions like alcoholism and smoking, and the importance of reducing the weight and the consequence of diabetes on heart disease is incredible, and I think this is really going to have a big impact. So without giving you further details, what I encourage you is, if you are struggling with your weight, and especially if your BMI is above 40, then I encourage you to speak with your physician about the GLP medicines as an option. And if they weren't and you tried before, it seems like the availability is increasing month by month. So be in touch with your provider, and I think that you will notice some real changes in your life. And I really think that this is going to take over for the surgery gastric bypass, and that will be far, far less, if not ever, used again with these medications. I'd like to add an addendum to my GLP-1 discussion. Taking the medicine does not substitute for healthy eating, healthy exercising. I want to encourage you to try to eat healthy, to follow a good nutritional diet, which I've got in some of my other videos. What I'm saying is that the GLP medications will help you adhere to it much more easily. Also, if you add exercise, especially with some weight training and a little bit of extra protein, I don't think that the muscle loss is of great concern. If you are not exercising and you're not eating the right balance of foods, then you're going to lose fat, and you will also lose protein, and that can lose muscle, which is protein, and that can be a problem. So I encourage you to still exercise and eat well if you're going to be considering a GLP medicine, and not as a replacement for those good and healthy habits. Just wanted to make sure that was message that I communicated to you. Thank you.